thank you all for being here. The Gender Pathways in Agriculture to Nutrition panel presents 4, I think, excellent papers that present a rich set of both methods and approaches to unpack the role of gender in ANH. We're going to have Rebecca come on up.
So catch-up growth is defined as a height velocity higher than normal during a predefined period of time, which usually follows a period of growth restriction. And the reason why catch-up growth matters is that there is evidence to support that infants who are small for their gestational age are at an increased risk of morbid mortality and also have a higher likelihood of being stunted in infancy and in adulthood, which may have implications for later adverse outcomes, such as poor pregnancy outcomes. And in geographical settings where the prevalence of stunting is very high in early infancy, the physiological phenomenon of catch-up growth may be beneficial, especially for infants who are small for their gestational age. So the objectives of this study were to estimate the proportion of infants who experience catch-up growth in length in their first year of life in a rural community in Pakistan, and to also assess predictors and barriers of catch-up growth. And for the rest of the talk, I'm going to be referring to catch-up growth, but please bear in mind that I'm talking about catch-up growth in length rather than in weight. So the data come from a longitudinal observational study of mother-infant dyads in the rural Sindh province of Pakistan, with a baseline study conducted when the infants were aged 2 to 12 weeks of age and repeated at endline when the infants were aged 9 to 15 months. We collected a range of socioeconomic and sociodemographic characteristics alongside maternal and child nutrition and health variable. And we also collected information on weight and height or length for both the mother and infants at both time points. So for this particular analysis, we included a wide range of exposure variables from individual and household level factors, nutrition and health related factors, and cotton harvesting. The reason for including cotton harvesting was that we hypothesized that women with heavy workloads, agricultural workloads, may have less time to devote to childcare, and therefore this might compromise linear growth. So to define catch-up growth, which was our outcome of interest, we started by generating sex-specific infant length for age according to the WHO growth standards. After removing outliers, we generated the conditional length for age Z-score change, which is basically the regression of the length for age Z-score at time point 2 on the length for age at time point 1, and you get the residuals, and the residual represent that growth, conditional growth. And to then define catch-up growth, we used international cutoff that has been used widely in research of 0.67 to define catch-up growth. And this is clinical relevant cutoff. And so any infants who showed an increase of greater than 0.67 in conditional length for age Z-score change were defined as being part of the catch-up growth group. We then ran some univariable and multivariable logistic regression, which were informed by a directed acyclic graph. And just briefly, directed acyclic graph allows you to get a visual representation of all the variables in your model and see how the exposure and covariate and confounding factor with the outcome relate. And that, in a way, inform the model building process and allow you to see which variable you should adjust for or not. So this slide on sample characteristic really highlights the poor environment in which these infants live. As you can see, the 9% of infants achieve the minimum dietary diversity, which is defined at consumption of 4 groups out of 7, at least 4 groups out of 7. Maternal height was low. And we had a low proportion of mothers who were educated, and most of the women were involved in agricultural-related work, and 71% of households were defined as being food insecure. Before I go into detail in terms of anthropometric characteristic, it's important to mention that at baseline, the length for age Z-score were minus 1.8 for the overall sample, so when the infants were aged 2 to 12 weeks. And that placed our sample on average on the 3rd centile, which is really low, and which again, these figures are indicative of some kind of growth restriction, which probably happened in utero. But if we now look at findings stratified by catch-up growth group or non-catch-up growth, we can see that at baseline, the proportion of stunting was similar in the catch-up group or non-catch-up group, but at endline, we can see that there was an increase of 1.6 in the length for age Z-score, which approximated to about 4 centimeter increase. And the prevalence of stunting in the non-catch-up group was 5 times higher than in the catch-up growth group. But the key findings on this slide is that we have 23%, so about a quarter of the infants who did experience catch-up growth within that 11-month period. So if we now look at the predictors of catch-up growth, in terms of the socio-demographic factors, we had maternal height, maternal education, and paternal education, which were positively associated with catch-up growth. So a taller mother, a higher educated mother, higher educated father were associated with an increased likelihood for the infant to catch up. And the effect was stronger for maternal education and maternal height. Similarly, we see that the household wealth index was positively associated with catch-up growth. And if we look at infants living in the wealthiest household, we can see that they were 3.5 times more likely to catch up compared to those in the relatively poorest household. We also had a positive relationship between the number of adult female and catch-up growth, where a higher number of female caregivers within the household was positively associated with catch-up growth, and a negative relationship between the number of children under 5 and catch-up growth. So the higher the number of children, the lower the likelihood for that infant to catch up. Surprisingly, within the nutrition, hygiene, and agriculture-related factors, only current breastfeeding status was negatively associated with catch-up growth, which was a surprising finding for us and not really clear. But cotton harvesting, after adjusting for SES and education, the relationship disappeared as the confidence interval overlapped 1. So in summary, I think one of the interesting findings is that we had about a quarter of these infants, despite living in challenging environment, that exhibited catch-up growth within that period of 11 months. And we also identified several modifiable factors that could be used at target points to improve linear growth, and especially factors related to women. So in terms of the factors positively associated with that, we had maternal height, maternal education, and the number of female caregivers in the household, as well as household wealth. And in terms of factor negatively associated, we had the number of preschool children in the household and the infant being currently breastfed. So these findings really highlight the need to strengthen or develop a nutrition-sensitive program that specifically address and target factors related to women. And some policy options could be, for example, income-generating activities for women and strengthening and promoting maternal education and social support programs. Thank you very much.